For swinging by our presentation today. Our project is called Care for Patients Receiving Comfort Measures Only, Experiences of Bedside Nurses. We developed this project with an understanding that we often transition patients in the ICU to comfort measures only, but little is known about the nursing experience when it came to providing this care for our patients. Our project's goals were fourfold. We wanted to explore how often we were including nurses during our discussions surrounding comfort care, frequency of moral distress experienced by nurses when providing this care, the most commonly asked about topics by patients and their family members when it came to comfort care, as well as whether or not there were any differences in question type depending on ICU type. Our project design was the development and distribution of an online survey to neurocritical care as well as medical cardiac ICU nurses. Based upon results, we found that there's a discordance between how often nurses prefer to be included during discussions surrounding comfort care versus how often they were actually included. Most nurses experienced some degree of moral distress, with those who felt well prepared to answer family members' questions experienced overall less moral distress. Most of the questions that patients and their family members asked about were regarding timing of death, medications for symptom management, as well as breathing patterns. And lastly, nurses who were in the neurocritical care ICU were more often asked about timing of death and medications for symptom management. Based upon these results, we feel like there needs to be more inclusion of nurses during discussions about comfort care. These discussions should also be tailored to address most commonly asked about topics. And lastly, more research needs to be done into the drivers of moral distress experienced by our nurses who are taking care of our patients on comfort care. We hope you walk away from this presentation learning something new, and thanks again for stopping by.